just for anybody watching, I work as a standardized patient at a couple of different medical colleges. They hire actors to come
Hmm.
in and pretend to be the patient
Hmm.
for um for the medical students, and they tell you, so they give you a background and a character, and it's, hi doctor, I have blah blah blah, I'm here with chest pain and I have a blah blah blah, and my name is such, whatever. What in my early days of one of my first encounters that I went in and I did it, I was playing someone who was complaining that I had chest pain, and I was in there with a senior SP who was giving me notes after, and she says, listen, you did great, you have to remember to play it like you're in pain. And I'm going,
Mm.
I thought I
Yeah,
was.
right.
I
Oh
thought
my
I was.
goodness.
So yeah, so normal person, chronic illness, playing it as if I'm in pain reads differently than normal people. So clearly I
Absolutely.
have to turn on
Absolutely.
masking all the time. So I have
Yeah,
to turn it up. Um,
legit. Kat, I mean, I totally get that. I think the only thing for me was that, and I have had different doctors for different reasons. The one thing that sort of took me for a loop, though, is that my grandma had ALS,
okay.
Lou Gehrig's disease, and of course, I think that I've reached an age that I am unlikely to have had the genetic, or she is unlikely to have had the genetic form and passed it on to me, which thank goodness. But when I mentioned to my doctor that my grandma had ALS, my doctor was looking at me strange, like, what the heck is ALS? And it's like, well, you are the medical professional. Well, I shouldn't really know more about this
Oh
disease
my
than you do.
God.
Um, but I mean, I will cut the doctor some slack. I will say, look, if you haven't seen these cases, because that, but the thing is, it does diminish the trust. But also having a doctor that is honest with you and says they don't know, that actually is somewhat reassuring because it shows that they're human. And if they're willing to admit that they don't know something, that can also go some ways to say, well, you're a human being. And then you see me as a human being and you can
Yeah.
treat me as a human being.
My psychiatrist, I've been seeing her for over 20 years. She is the best person on the planet, to the point where after my OBGYN retired, it put me in a panic. And I called my psychiatrist and said, you're not planning on retiring anytime soon, right?
Oh,
And when
right.
you do, you're gonna like
Right.
give me, send me to somebody else that is good to take care of me, right? And
Right.
she laughed and was like, no, 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 you're fine. I'm fine. I'm not retiring anytime soon. And
Oh,
when
good.
I will take care of you. You're fine. It's all fine. Well, because that's stressful. It's so hard to find one that you like. And when you find one, freaking cherish them.
Right.
My I'm a recovering anorexic, and
Mm.
I had been looking, so, oh my God, I've been trying to get somebody to like help me with, is there a medication or a something, whatever. And it was always because I don't weigh 80 pounds and I'm not morbidly
Mm.
obese. So there's
Right.
no help for medium-sized people. But the
Right.
anorexic depression was getting really, really, really bad.
Right.
And but everybody was telling me, go to a nutritionist or go to a therapist. That's the only answers we have for you. And my psychiatrist, all on her own, went and did research and found me an endocrinologist to go to.
Mm.
And so I go to this endo who is amazing. Her office, she's not in network, of course. So the office visit was a zillion dollars. Don't
Mm-hmm.
care. Best money I ever
Mm-hmm.
spent.
Mm-hmm.
And she does her thing and she fixes me, right? She prescribes this thing, which fixes me. And I go back in for a follow-up, and I'm prepared to spend ungodly amounts on regular visits with her. And
Right.
she says, well, listen, I can look, I will always be here for you when you have need, but if you have need, but now that we know what's working for you, I can call your psychiatrist and you can get these meds through her. You don't have to
Mm.
keep coming to me.
Mm-hmm.
And I
Mm-hmm.
went, whoa, whoa, wait a minute.
Right.
You're you're actually She said, "Well, yeah, I mean, in medical school, they taught us to make things as easy and inexpensive for the patient as possible." And I said,
Mm,
I'm sorry, I'm only looking
right,
at you like you're nuts because I've just experienced far too many of your colleagues that were apparently sick that day.
right, right.
That's amazing.
Yeah,
Thank you.
yeah.
Anybody
That is
needs an amazing endocrinologist, Dr.
yeah,
Messer, NYC. She's fabulous.
awesome.
But like, who, I mean, I'm still flabbergasted. I actually
Right,
called her office during the pandemic to tearfully thank her office and say, listen, this would suck so much more if she hadn't fixed me. And I also went
right.
all help and,
Mm.
left good reviews wherever I could.
Oh, good, good, good.
Like I said, when you find someone, I was telling you before about my girlfriend who has lupus. She was in the hospital recently, and her husband goes with her all the time, but her husband is a very nice person.
Mm.
And I'm like, no, I need to go with you. I need
Right,
to go with you and be
right.
a medical advocate
Mm-hmm.
because you need someone who's going to be slightly less of a nice person looking
Right.
for you. They, without telling her, took her off of her psychiatric meds
Wow.
while she was recovering from she was in for a hip replacement, and they
Mm-hmm.
they stopped her psychiatric meds cold turkey
Wow.
and didn't tell her.
Wow.
She was
That's terrible.
suicidal.
Yeah.
By the time she figured out why she was feeling suicidal, I went, "Oh my God, it's because I haven't been on my psychiatric meds, on my
Right.
antidepressants, etc., for 10 days.
Right.
What the hell?"
Right.
And she's written to the hospital, she's written to the doctor, she's written to everywhere about what the hell, guys, and nobody's responded.
Wow. That's just crazy.
It's unconscionable. It's
Yeah.
terrible. So, it's you gotta it's part of why I wanted the job as a
Right.
standardized patient because we are helping to build better doctors.
No,
We
that's
are,
great. That is
you
really
know,
great. Letting
allowed.
doctors know. Yeah.
And I said to her, I'm like, I literally, I know what they're supposed to be doing.
Mm-hmm.
I
Mm-hmm.
know how they're supposed to greet you. I know that they're
Mm-hmm.
supposed to ask you about pronouns. I know that they're
Right.
supposed to come in and ask if there's something other than your legal name, what you would like to be called. I know
Right.
they're supposed to be doing that. And
Right. Right. Right.
so,
Yes.
it is, yeah. Um,
Yeah.
so take me with you. I'm a valuable asset now. But
Absolutely.
it's yeah, it's so important. And because like Dorothy says, is this your
Mm-hmm.
healing profession? Is this your
Mm-hmm.
kind profession? Is this healing? And it should be.
It
It
should
should
be.
be. I was in the other day I observed a student and then I was with a student. And the one that I was with, oh, he was lovely. I don't have enough nice things to say about this kid, even
Mm.
though he missed a bunch of things on my physical exam.
Mm.
And yeah, I gave him the notes and yeah, you missed a bunch of stuff and yeah, it was okay. But his bedside manner, he's going to be
Mm.
amazing one day. He's going to be
Awesome.
fantastic. Tell me when
Awesome.
you start to practice. I'm not allowed to say those things to him, but I want to know
Right. Right.
practice.
Right.
But the other one, woof. Um,
Mm.
Sweetie Pie, you got some homework to do.
Right.
And we had to find nice ways to, helpful, nice ways to say,
Mm.
probably there's some reviewing that you should do of you should be going back to basics,
Yep.
friend, because
Yeah. Oh, yeah. I mean, me personally, I'm like I had this dentist that I really liked going to, and he's mostly out of network. I believe me, the insurance it pays a little bit. It don't pay all of it. But I go to this doctor, and I liked the doctor that used to be my doctor. It used to be my dentist. But eventually, he started peeling back and doing fewer patients, and he got more people in his practice. And I was a little worried that I got a different doctor in the practice, but I found the new doctor was also pretty good. I liked working with her. I think she's sociable and friendly and takes good care of my teeth and gives me good advice. So I'm happy. And as far as my therapy is concerned, now that I face losing my insurance, technically speaking, it doesn't change much. When I got my insurance, I got the high deductible insurance, and because I wanted to start accumulating an FSA, or excuse me, an HSA, a high deductible insurance savings account, because those are savings accounts you can bring into a retirement. And so I
Yeah,
was really looking forward to my retirement, which I'm hoping this is not. I want
well,
to go back to work,
yeah.
but um, I already was paying full price on the therapy anyway, so pay full price continued. And I have no qualm about continuing at full price. That's how much I think the therapy is working for me. And it's all about that. You find the one that works for you and you work with them and you pay whatever you can, and whatever you can shouldn't be exorbitant. It should be something that you can afford. That's what I mean by can afford. That's really the golden ticket. That is what we all are asking for.
I mean, I think something you just said is a big, I think you just hit on a really key point. You said you work with them, and that's one of the big key things that we look for is, do you feel partnered with the doctor? Do you feel that this doctor is a partner in your care?
Right.
And if the answer is no, you probably want to either you should poke that doctor with a stick
Right.
or find a different one.
Right. Absolutely. Absolutely.
And
And
it's
that
totally okay to poke a doctor with a stick.
yeah. Yes, I mean nothing like a point head stick to
Hi, pay
get them.
attention to me.
Yes, absolutely. Absolutely. And that's the best advice I can give. And Kat, thank you so much for sharing your experience, because I think just listening to you, I've learned a lot, and I really appreciate that.
Of course.
So thank you. Thank you for coming to the Green Pill Secret with me and with Kat. And we hope to see you next time.
Okay, bye.
Bye.